This is a CJASN podcast, and I am Christine Bakhoum from Yale University. It is my pleasure to share with you the results of our study, in which we evaluate the relationship of blood pressure dipping with left ventricular mass index in children with chronic kidney disease. Normally, blood pressure decreases by at least 10% at night. The absence of this decline is defined as non-dipping. In adults, non-dipping has been associated with worse cardiovascular and kidney outcomes. However, the impact of non-dipping in children, particularly in those with CKD, is largely unknown. Children with CKD are at high risk for early onset cardiovascular disease, so it is important that we identify any potentially modifiable risk factors in this population. We studied the risk factors for non-dipping and its relationship with left ventricular mass index in the chronic kidney disease in children, or CKD cohort. We found that risk factors for non-dipping differed by etiology of CKD. In those with non-glomerular disease, higher sodium intake and female sex were significantly associated with blunted dipping. In children with glomerular disease, greater proteinuria and African American race were significantly associated with blunted dipping. We did not find a significant relationship between blood pressure dipping and left ventricular mass index. In an exploratory analysis, we tested different thresholds for diastolic dipping. While there was a trend towards higher left ventricular mass index in those with diastolic dipping less than 20% and above 25%, this was not statistically significant. Further work is needed to evaluate the relationship of nocturnal dipping with other clinically relevant outcomes in children with CKD.
This podcast is copyrighted by the American Society of Nephrology, all rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare provider if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.